Very good evening to everyone, and welcome to this important interactive session. First and foremost, we would like to welcome Dr. Sue Royappa. Thank you for joining us. We know that it's early in the morning where you are. Thank you for sparing your time. And we'd also like to thank everybody who's tuned in, and also to T7, the largest electronic news network here, for bringing this to all of us live. So before we begin, just a short introduction of you, Sue, so that all who have joined in get to know you. So Dr. Sue Royappa is an internal medicine physician with extensive and diverse experience in clinical medicine, management, business, and teaching. She works in global preventive health to integrate patient care, medical education, and public health in the US, and also multiple chronic diseases in the US and in India for over 20 years. And as a public health professional, she is passionate about using technology to increase awareness and improve access to health education. So Sue has a really long and illustrious CV, but it's always nice to read and to tell everybody about it. So Sue received her MD from the University of Mississippi in 2001 and completed her residency at the Presbyterian Hospital of Dallas in 2004. And after a decade in private practice, she assumed the position of Chief Medical Officer of Health Secure EMR and received her MPH in Health Promotion and Behavioral Health from San Diego State University. She also has a bachelor's degree in physics from Purdue University and worked as a high school and college mathematics teacher prior to her career in medicine and public health. And what is very interesting, I'm sure, for everybody listening today is that Sue grew up in Shillong and she schooled here and went on to become a Fulbright scholar. And today she's the Chief Health Officer and member of the COVID-19 mitigation team for Hideaway, Texas. So welcome again, Sue. And before I hand it over to you, just a bit about the format of this program today. We have asked people to send in questions and concerns over a WhatsApp number, and several have come in. But people who are watching can continue to send in questions on whatever platform you're in the comments. You can type your questions, and Sue will be more than happy to answer all of those after she does a brief sharing. So over to you, Sue.
Thank you so much, Angela. It's an absolute privilege and a pleasure to be here. I wish we were gathering in less difficult circumstances, but it nonetheless just brings me so much joy to talk to people from Shillong. I have some of my absolute favorite memories from childhood in Shillong. So thank you so much for giving me this opportunity to join you all today. There has been so much fear, so much confusion, and so much heartbreak in India over the last few weeks. And I'm hoping that today this session can bring some clarity and some calm to those of us participating. I want to bring a message of hope balanced with a message of caution. There are two groups of people that I've run into. One group is very afraid, terrified of the virus, terrified of what it's going to do to them and to their family. They're scared of being out, even stepping out of the house. And they are just in constant fear and worry and depression. And then on the other extreme, we have the other group of people that feel like this is nothing, that this is all either a conspiracy, they're in some sort of denial where they feel that somehow this virus is not going to touch their lives or the lives of their loved ones. And they continue to go about doing things that they would have done prior to the pandemic. So people still going out in large crowds, going and to functions and festivals and birthday parties and weddings and whatnot. So the reality and the truth is somewhere in between. So to the people on the left that are terrified and scared, I want to provide some comfort in letting you know that this is serious, but it's not as terrifying as some of the people feel, that every person who gets coronavirus is going to be severely sick and be hospitalized and die. In fact, the death rate, according to the WHO, is less than 1%. Now, less than 1% doesn't mean it's not serious, but neither is it catastrophic, like 50%. So we have to always put things in perspective. But 1%, when you have a large population, let's say, if 100 crore people get coronavirus, then 1% will be 100 lakhs, right? So that's a large number of people still. So that's what I want to tell people on the other side who think that they are in denial, that this is real. Well, 2 lakhs of people have already died in India, and 6 lakhs have died in the United States. So this is very, very real. But this is something that we know how to manage, we know how to prevent. So we have a lot of control. There is no reason for us at this time to feel helpless or hopeless, because we are in a very different position now than we were 1 year ago when I was addressing a lot of people. I know not specifically to Shillong, but I've talked to a lot of people in India. Very different at that time when we didn't know what to do. We didn't know what this virus was, how it was spreading, how dangerous it was, how to treat it. Now we know a lot more, and I want to share some of those things with you. The first thing is that the virus has variable symptoms. So not everybody that gets infected is going to get sick. In fact, most of the people, 80% of the people, are not going to get severely sick. And up to 40% of people are not even going to know that they're sick, which means they're going to have no symptoms. So unless you actually test them, they are not going to have any symptoms. But the remaining 20% of the people, those are the ones that can have significant symptoms. A lot of the symptoms are very similar to other viral fevers, fever, body aches, coughs, nasal congestions. I mean, we see that with all the other types of viral infections. But most of them don't lead to shortness of breath, difficulty breathing, chest pain. Those are the things that when it becomes serious, we can have those problems. So it's a very variable picture. And there are a couple of things that are very specific to the COVID. And that I'm going to use the term COVID and coronavirus sort of interchangeably. COVID is one of the coronaviruses. But what this does is you can have loss of smell or taste that I know by now a lot of you know about it. And the big thing that it does is affect your lungs. But again, most people are not going to have severe symptoms. You're going to treat it the way you would any type of viral infection, cold or cough. So who are these high-risk people, these 20% of the people that get really sick? So the first thing that we found out that this virus, unlike some of the other ones, is it affects primarily older people. So the highest risk groups are 60 years and older. Obviously, the very high risk groups are the really elderly, 80 and older. But in my mind as a physician, I'm thinking 60 years and older, that is the high risk group. So those are the people that have the chances of getting severely ill, being put in the hospital, being put in the intensive care unit, ventilated, and possibly even die. So those are the people that we really need to protect initially. And then the next set of group of people are people, 45 and above, and then finally the younger people. And if you are in the younger group, less than 60, the highest group of people with risk for severe disease are high blood pressure, diabetes, heart disease, and obesity. And of course, chronic lung diseases and stuff, which are not quite as common as the other 4 that I mentioned. So now I want to talk to you about a couple of myths regarding COVID. So the first one is if you are positive for COVID, then you need to go to the hospital. And that is absolutely not the truth. Right now, we're reading about how there's a shortage of beds in the hospitals in India. So I have just told you that 80% of people do not need to go to the hospital. So please don't go to the hospital if you don't need to be there, and take a bed from somebody that really needs it. And they may need the bed not just for COVID, they may need the bed for somebody who had a heart attack or who had a stroke or all the other things that normally happen. Sometimes in the pandemic, we forget that all this other stuff exists, not just COVID. So don't go to the hospital unless you are not well. And I will talk to you about when to go to the hospital. The second myth that I'm seeing is that if you get coronavirus, then you need to go get a CT scan of your lungs. And that is absolutely not true. The American College of Radiology is very, very clear about that only very limited number of people need to get CAT scans. So do not use up limited resources, because we don't want to be rushing in and using the CT scans when we don't need them. And not only that, there needs to be disinfection of the CT scanners. You don't want to get coronavirus by putting, unnecessarily going and contaminating equipment. So those are two myths that I want to talk about, that I wanted to mention. And the next thing that I want to talk about are the myths relating to how you can protect yourself at home or treat yourself at home if you do become positive for COVID. First of all, there are no tablets, no injections, no syrups, no tonics, no herbs, no leaves, no any type of cure at present. So if anybody is offering those to you, that is not correct. So we will definitely get these treatments, but we don't have them yet at this point. So please do not use things that you see people recommending on WhatsApp or Facebook. I mean, that's become the major problem for us physicians, is to fight misinformation. So I've been seeing videos on WhatsApp about steam inhalation, where you're breathing in the steam, but they're putting in eucalyptus oil or lemon oil, and sometimes they're even breathing in camphor fumes. Unfortunately, this is causing more problems than actually helping you, because these particles, when you aerosolize into your lungs, they can cause lung damage called pneumonitis. So please do not breathe things in. The breathing of just plain steam is good for nasal congestion only. It's, that's the main reason to use it. So not for preventing coronavirus, and definitely don't put anything into your water if you are going to be steaming. But my personal recommendation is just to avoid anything of that nature. Then the other video that I'm seeing going around is to prone yourself. Prone means to lie on your stomach. And please know that proning is a hospital technique. It is not something that we are recommending that you do at home, because it is very difficult to know the right position, especially elderly people. You don't want to prone people. Proning is done in select groups of patients in the hospital under careful medical supervision, and it's done on people that are not able to oxygenate. If you are feeling poorly enough that you're wondering, should I be proning, that is lying flat on my stomach and trying to sleep that way and staying that way, then that means it's time for you to go to the hospital. So please don't hesitate to do that. So if you're thinking, oh, I'm having trouble breathing, or my oxygen level is low, anything like that, you need to go to the hospital. So what you need to do at home is, if you have coronavirus, just treat yourself like you normally would. Rest, not bed rest. We never want bed rest. Still walk around. Isolate yourself from the rest of the people at home. Take paracetamol 500. That is something that is safe for everybody to take. I'm talking about adults here, not children. There'll be childhood doses based on what your pediatrician tells you. For adults, 500 milligrams of paracetamol, only if you have high fevers, like 38 degrees Celsius or above, or if you're having, aches and pains and body aches and headaches and that kind of thing, then go ahead and do that. And drink plenty of fluids and eat a nutritious diet. Now, if you are able to get a pulse oximeter, I don't know how many of you are familiar with that. It's a little device that you put on your index finger. What I don't want you to do is all go rush out and buy a pulse oximeter. There's not a pulse oximeter, enough pulse oximeters available for all of us to buy one right now. But if you have high-risk people in the home, so the high-risk people, right, 60 years and older, or if they have chronic medical conditions, then it is good to have a pulse oximeter if you can get one, because then you can monitor the pulse oximeter if you're a positive COVID 3 times a day. And if normal is 95% and above, if it becomes less than 95%, then that's time for you to start seeking medical attention. Okay, this is really important. If you're having difficulty breathing, if you have chest pain, or if your oxygen level comes down, or if your fever is not coming down despite giving paracetamol and you're feeling really poorly, then please take yourself to the nearest hospital to get medical attention. Now, once you're in the hospital, I want to also dispel a couple of myths over there, because there is no cure yet. We will get it, but we are not there yet. We've been trying all kinds of different treatments for the past year, the world over. So, and I'm seeing requests on WhatsApp for plasma. Now, plasma, when they say plasma, they're talking about convalescent plasma, which is, let's say I got COVID, I recovered, and my body made antibodies, and now you're giving my antibodies to somebody else who's sick. Unfortunately, plasma, we have now determined through very good trials that it is not helpful. So please, I don't want you all to be going around frantically looking for convalescent plasma. That is not currently recommended as a treatment. The other thing that I am seeing desperate pleas for is Remdesivir. And again, Remdesivir is not a cure. So it is given in very select patients to help reduce the number of days that they stay in the hospital, and it helps reduce the severity of symptoms. We still do not have a good clinical trial that shows that Remdesivir has actually prevented death. So I want to make sure that you guys know that, because there's a lot of guilt over families that are not able to afford or get Remdesivir as though it was like this magical treatment. It is not. It is just one of the things that we have in the treatment opportunities that we have right now, but it's definitely not this magical thing that we have. And lastly, what we really do have, something that is very cheap and effective, is steroids. But I'm a little bit scared in telling people about this, because in India, I know you can go to the pharmacy and pretty much get what you want. When I'm saying steroids, please don't go to the pharmacy and buy steroids, because you can actually cause a lot of harm. You may actually die. So steroids are very, very important drugs, but they're also drugs that need to be very carefully used by people that know how to use them. Doctors will use them very specifically in very specific patients in the hospital. So please do not run out and buy steroids in the pharmacy. They are meant for use in the hospital only. So now that we've talked about it, we know that right now, we're having problems with shortage of oxygen, shortage of beds. So what can we do? What we can do is prevent, prevent, and prevent. And 1 year ago, we talked about masks, social distancing, and making sure that you don't go into crowds. And those three things still matter. But we now have a miracle of science, and that is the vaccine. The entire world has come together, and we've worked together to come up with a vaccine multiple vaccines, not just one, multiple vaccines that are effective and that are safe. So we're no longer helpless. We can do something. We can prevent ourselves from getting this vaccine. And so this is going to be really, really important. And obviously, what's happening is now people are understandably afraid because it's something new. And so I want to assure you that there's nothing in life that is 100%, 100% with no risk. Anything simple is going to actually have some risk. So, but I want you to understand what this risk is. So we have the data for Covishield. Covishield, which is AstraZeneca, has a risk of blood clots of between 4 and 6 people in 10 lakhs of people. Okay, I want you to remember this: 4 to 6 people out of 10 lakhs, versus if you got coronavirus, then the risk of you dying from it is around 1 out of 100 in certain high risk groups. So 1 out of 100 or 4 to 6 out of 40 lakhs. Okay. And let me use an analogy. of something else that we don't even think about, and that is road accidents. We always get into a car without even thinking twice. I have been I remember very distinctly walking from Moti Nagar to Danketi to my school, Loretta Convent. And probably a lot of people now don't even walk. They get into the car and go that distance. But during that time, you're not thinking, 150,000 people die of road accidents in India. And there is a car accident death, one death every 4 minutes. Do you think about that? No. You get into your car. When you buy your car, do you have assurance around from you that you will never get in an accident? No. But you still take that risk because the risk is small. And right now, the risk of the vaccine, the clot from the vaccine, is extremely small. 4 to 6 people out of 10 lakhs versus 1 out of 100 people who could potentially die from the coronavirus. So I hope that you will all be able to embrace the vaccine. And I know there are lots of questions about the vaccine. Maybe I can talk before I go. I want to mention one thing. High risk people need to be vaccinated first. So 60 and above. When there is a shortage, if we have a vaccine for everybody, it's fantastic. We can all go get vaccinated. But if there is a shortage of vaccines, then we need to protect our people that are going to get really sick. And those are the people that we need to keep these vaccines for, 60 and above, 60 and above. And then, and after that will be people who have diabetes, high blood pressure, heart disease, and obesity, and other chronic diseases. So I am going to go ahead and turn it over to Angela so that she can start asking me some of the questions. I think she said I had about 15 to 20 minutes. We're coming right at about the 20-minute mark. So Angela, over to you so that we can have some discussion.
All right. Thank you so much, Sue. That was really useful. People requesting that if you could have this in Khasi, so maybe you can have a crash course in Khasi and we'll
sure,
do this
absolutely,
again.
Absolutely. Kumno, ale hangne. I remember a couple of things.
So should we carry on with questions on the vaccine, or should I just ask randomly?
Sure, go however you feel. Yeah, let's just go however you have them. Yeah.
So there were these questions that came in on our WhatsApp. Mr. Foreman asked, in the recently shared second interim results of the phase 3 clinical trial, Covaxin demonstrated 78% overall efficacy and 100% efficacy in severe COVID-19 cases. How do you gauge the efficacy of so many vaccines available in the market? Will the vaccine stop infections?
Yeah.
Then there's a similar one. In a scale of 10, please rate the preventive strength of Covaxin and Covishield against the new coronavirus strains in India. A question by Mr. Mukhim. And so those are the vaccines.
Yeah, let's get started with some of those, and that is the relative efficacy of the different vaccines. And there are different vaccines available throughout the world, and I'm going to talk about the two that have been approved in India right now and widely used. And I think a third one, the Russian one, was also approved, but I'm not sure if they're actually giving it out. The two that are there in India right now are Covishield and Covaxin. Covishield is the one that has been used in the UK and many other countries, the AstraZeneca vaccine, and Covaxin is the vaccine that's been produced in India by Bharat pharmacies. And both of them have very similar efficacies, which is around 80%, which is fantastic. When I say efficacy, the term efficacy, 80% means transmission in terms of do you become positive after you get COVID or not. But the 100%, what they're talking about is reduction in severe disease. So to me, that is really the most important thing, because, okay, you get the positive COVID, you stay home, and maybe you have a fever, you have body aches and chills. But the most important thing is that you don't go to the hospital, you don't get on the ventilator, and of course, that you don't die from the disease. So these are from the clinical trials that have been done. Both Covishield and Covaxin have gone through the clinical trial process. Now real world data has been out for Covishield now for quite a while, because it has been given in many other countries. So we do have real world data. And we're really hoping for real world data from Covaxin as well. And I read that the Indian government or the scientists are planning on having the real world data by around June. So I'm very excited and hopeful that those will show just as good of results as they have been in the clinical trials. And as far as which vaccine to get, whichever vaccine is offered to you right now, that is the vaccine to get, because they're all been shown to be effective, and they have shown to be safe in the time that we have used them.
All right.
Angela, I hope that answered the question. Is there any,
yes,
please let me know if I missed something.
All right. There are more questions on the vaccine,
Sure.
which have just come in. Some people are saying, is Covishield safe for people who are having BP and sugar? And if we're taking any other medicines? And then earlier on also, there were some questions about, should a woman who is planning for pregnancy take the vaccination? This question is also for the husband.
I will. I'm going to stop you for a second there. I'm going to do the first one first, and I'm going to come back to the pregnancy one, because I've had a lot of questions about the pregnancy, and I'm glad that we have this question about safe for people having blood pressure and sugar. Absolutely, those are the people that need to be taking the vaccine. Are the people that have the high blood pressure, the people that have the sugar, that are taking the medications. You are the people for whom these vaccines are made. Okay. Unfortunately, there's been one little rumor going around in Tamil Nadu. I don't know if the same thing is happening in Meghalaya or not, that the people need to stop their medicines before they take the vaccine, and then stop the medicine for a few days after they take the vaccine. Absolutely not. You should be taking your medication unless for some reason your doctor specifically says that you should stop this. Up to now, I can't think of anything, maybe like cancer patients have certain, medicines that they need to stop or something like that. But regular run of the mill, all of us, do not stop any of your medications, and either before or after. What we don't want you to do is worry about the side effects and think, oh, I might get a fever, or I might get, my arm may hurt, or I may have a headache, or I'm going to get aches and pains, and then start taking ibuprofen or aspirin or something before they go and get the vaccine. And that you do not want to do, okay? Because that can reduce the immune response. But if you're already on those medicines on a regular basis by a doctor, then it is safe to continue them. And after the vaccine, if you do get, if you just get a little bit of a fever, and if you're just staying in bed, no need for taking paracetamol or anything like that. And if you're feeling a little bit achy, there's no need to take that. And don't be constantly checking your temperature all the time. Your body will let you know when you're not feeling well. And when you're not feeling well, and if you're really achy, perfectly safe to go ahead and take a paracetamol after the vaccine. Okay. Angela, I think I'm going to go ahead. Do you want me to go ahead and answer the
question? I'll just two more questions, because they're related. There's one that's just come in that's saying that, is the vaccine safe for seniors going through kidney dialysis? And we had an earlier very detailed question from a 35-year-old chronic kidney disease person who has just a single kidney since the last 5 years. She asks, can I get COVID vaccine, and will there be any complications?
Okay. These are all very good questions, and questions that have to be answered individually, because I do not know the full extent of their personal history. But overall, we are having patients with chronic kidney disease get a vaccination. There's no contraindication, means there's no, I don't know what contraindication means, you can't get it. There's nothing like that for kidney patients, for chronic kidney patients. We are absolutely vaccinating them. But in every person who has a chronic condition, please check with your doctor always, whether it is a severe thing like you have one kidney. But in my recommendation is, and from learning about what's going on there should be no contraindication for you, but you should follow up with your doctor.
Okay, so should we go into the series of questions from women
about pregnancy? Yes.
Yes. Is it safe when you're planning a pregnancy? I'm a breastfeeding mother of a 7-month-old baby. Is it safe to get Covishield or Covaxin? Can pregnant and lactating mothers take COVID vaccines? Is it safe, and do lactating mothers need to stop breastfeeding? If yes, for how long? Some doctors are of the opinion that vaccination for pregnant or breastfeeding mothers is okay, while there's some who say it is not safe during lactation. So as a breastfeeding mother, I'm confused. So please tell me, is it safe or not safe?
I know, the poor woman. I don't blame her for not being confused, because there is so much different types of information available. And the reason for this is not we're trying to make things difficult for breastfeeding women or for pregnant women, because breastfeeding women and pregnant women were not included in the initial trial. So that's why there are so many questions about it. So let me tell you what's going on right now in India versus in other countries. So in India, as of now, what I have read is that neither Covishield nor Covaxin are officially approved for use in pregnant women or in lactating women. But we're really hoping that the medical authority and the controlling authority there in India will come out and promote the use of vaccines in pregnant women and lactating women who are high risk at some point. Covishield currently is approved in UK for both pregnant and lactating women. We do not have Covishield here in the United States. We have Pfizer, Moderna, and J&J, and I believe they're all being used in pregnant women. We are having trials now with pregnant women, and we have not had any problems or issues with vaccines safety in pregnant women or in their unborn babies. The reason for this is we need to kind of look back at the science. Vaccines, all of these vaccines, none of them have a live virus in them. So the biggest concern about taking vaccines is if it is a live virus, am I going to give that to my baby? Am I going to get infected from the vaccine? That is one concern. And I want to let you know that there is no live virus in any of these vaccines. So it is impossible to get the disease from the vaccine. I've heard people who have said, oh, my neighbor got the vaccine, and then, a few days later, he got coronavirus and died. Well, he didn't get the coronavirus from the vaccine. He was already exposed to the coronavirus. It takes 2 to 14 days for you to get symptoms. So he may have been exposed and didn't know, went and got the vaccine, and then he, developed the illness. So moms need not worry that there is a live virus in these vaccines. One of them has only particles of the virus, the DNA particles of the virus, and the other one has an inactivated or dead or killed virus. There's no way for it to replicate. So we're hoping right now that India will, change its recommendations and make it available. I do not know what it's like in India in terms of how much freedom doctors have to give vaccines to pregnant women and lactating women there. Here, when it doesn't have official approval, we have some leeway to give off-label as long as we have good research and good data showing that it is safe. So as of now, it's been shown to be safe for pregnant women and lactating women in the UK with Covishield. So, Angela, back to you.
Yeah, thank you. There's just so many questions on the vaccine, and I guess it's because...
Yes, we'll try. We'll do our very best.
So there's another question. What about people who are allergic? Or what about people who are hemophiliac? So things like that.
Okay, well, allergic. Let me address the allergy. Yeah. Let me address the allergy. Let's go ahead and stay here together, and we can go back and forth that way. If right now, if you are allergic, we're not talking about small allergy. If I eat a tomato, my stomach feels upset. That's not the kind of allergy we're talking about. We're talking about real allergy, like anaphylactic type of thing, where if you take either a food or a drug and it causes severe reaction, like difficulty breathing, your throat is swelling up, your face is swelling up, you can't breathe, you're wheezing, that kind of stuff, or you break out in a rash all over, severe allergic reactions. They are still okay to get the vaccine, but they need to be careful. So what we do here right now is in the US, if you are just a regular person with no allergies, we keep you for 15 minutes after the shot. But if you have a history of an allergy, then we keep you for at least 30 minutes after the shot. And also my own patients, I tell them, if you have a history of an allergic reaction, make sure you're in a big hospital facility. I don't know how y'all are handing out the vaccines there, but here in the US, we have vaccines. You can go to the grocery store right now and buy your meat and at the same time get your vaccine. So I don't know what's happening in India, but so if you have a history of a severe allergic reaction, don't go to the grocery store to get your vaccination. Go to the hospital, so that if you do, the chances are extremely small. I mean, I can't even tell you how microscopic it is. Extremely small. If you do, then we do have the ability to treat you right away. I don't believe we have had any deaths from anaphylactic reactions or allergic reactions from the vaccines. We've always been able to treat it right away. The hemophiliac, you will have to talk to your doctor about it again, because I do not know your entire history. Right now, there are very, very, very few cases of people that cannot take the vaccine. Okay, so but talk with your doctor about that. All right,
So
Angel.
I guess that the other questions, similar thing about having gastro problems, can I take the vaccine? And then, of course, there's another interesting question about with the shortage in vaccines seen across the country. Can India and Meghalaya in particular just vaccinate the population with the first dose before we start with the second dose, so that it will cover a wide array of the population and thus achieve herd immunity in the process?
Yeah. That's a very interesting question, and a lot of people have been fighting out about it. Countries have been fighting over it. We've had different policies. I think it's both a public health question as well as a philosophical question. UK went with that strategy, where they went with one dose for everybody. The US did not go with that strategy. We went with trying to fully vaccinate as many people as possible. So the answer to the question as far as India goes is, how bad is the shortage? Because depending on how many vaccines you have, if you have vaccines enough for one dose for everybody, fantastic, give everybody one dose. But right now, just from what I'm looking at the numbers, we don't have that many vaccines. So really what we need to do is protect our high risk people, right? So why are we vaccinating young people? We're vaccinating young people so they do not spread it to the older and high risk people, right? But ultimately the people that we're trying to protect are the ones that we don't want in the hospital, that we don't want to die. So really, to me, regardless of which strategy you use, one dose first for a larger group of people versus trying to get complete vaccination, what we need to do is first address high risk people, because those are the people who are at risk of dying. Your healthy 19, 20-year-old is not going to die. They're not going to, be in a ventilator if they're healthy. Okay. Obviously, it's different if they have underlying medical problems. But a healthy 18, 20, under 30, nothing. You're going to be fine. But you're vaccinating those people so they don't spread. And it's important not to spread. Why do we not want the vaccine, the virus to spread, in addition to not wanting people to die? Is because the more the virus multiplies, the greater the chance of variants. It's only when the vaccine multiplies that we get new variants. So we try to reduce multiplication. So the more people are vaccinated, the less chance the virus has to multiply. So less chance for the virus to mutate. I'm going to go ahead and include somebody had mentioned the variants. I have a question here about whether the variants are going to be protected, derive protection from the variant strains. And we need to go, at this point, we don't know for sure, but we do have good data from the UK as well as from South Africa, that the strains people are seeing protection, cross protection. And we know from decades of research with other viruses like the flu virus and other viruses that you always get cross protection. It may not be 100%, it may not be as good, but what is most important is it's not about whether you become positive or not. It's about whether you get sick and die or not. If I get a positive test and I'm sitting at home and I'm, yes, it sucks, I got to stay at home and do all of that. But if I'm not severely ill, so don't say, oh, this vaccine is from 3 months ago and we have new variant now, so I'm not going to take the vaccine. It doesn't work that way, because the vaccine will still protect you from severe disease and from death. Okay, so please do not, prevent that, make that prevent you from taking the vaccine. Yes, Angela.
Okay, so some more questions about some concerns about Bill Gates and his comments about not sharing vaccine data.
I really feel, I mean, there may be individuals, and, I don't want to, talk about individuals in particular, but I really feel that the world has come together. The US, the UK, Australia. I mean, we're all come together initially and helping each other out. It's not like this one country. Our Pfizer vaccine, we did that from a German company, and those were Turkish immigrants. I mean, that's just fantastic. Look at what's happening. All the world's coming together, simultaneously sharing data. So I want to really talk about the positive things. There is going to be negative always. There's going to be negative stuff going on. Let's not focus on that. Let's focus on what we've accomplished. The miracle of the vaccine. Up to now, a vaccine took 10 years on average to manufacture. 10 years. The fastest vaccine before corona vaccines were 4 years. And because now people are not hiding their information, they're working together. We've got a vaccine in months. I mean, this is miraculous. So this is just so positive. I think the world is a positive place. People want to do good. People want to help each other out. And that's the majority of what we want to focus on.
Yeah, so that's the other question. What should be the gap between the first and second dose? Correct. Another question about if you take, say, COVID Shield as your first dose, can you take then the Sputnik one as your second? And the other one is after having been infected or after having recovered from COVID, how long should one then wait before one takes the vaccine?
Okay. I'll come to that one later. I'll first talk about the gap between the doses. So currently, Covaxin right now, the Indian authorities, they want 4 weeks, right? That's what's the current recommended gap between them. As far as Covishield, that was also the original recommendation. But remember now, Covishield has been used as the AstraZeneca in other countries. So specifically in the UK, there they are going anywhere from 4 weeks to 12 weeks. So let's say you got your Covishield and now there's a shortage and it's been 4 weeks and you can't get a second dose. Please don't worry about it. You are safe getting it after 4 weeks, up to 12 weeks. In fact, like in Australia and stuff, I think they're recommending that you wait a little bit longer, 6 to 8 weeks to go ahead and get the second dose. As far as taking one vaccine for a first dose and another vaccine for the second dose, here in the United States, that is, they've talked about that. We have not had a reason to do that because fortunately we've had plenty of vaccines. So we've not had an issue where one vaccine has been in shortage and another vaccine has to be given. But the scientific community feels that there should not be an issue in terms of mixing vaccines if needed in extreme cases. But India has not officially come out and said that that is okay. All right, their regulatory bodies have not said that that is okay. I do want to mention, I have nothing against Russian vaccines or anything like that. I do want, and I'm very excited. It looks very good in terms of efficacy, the Sputnik 5. But I just want to know there's want people to be aware that Brazil who has ordered a bunch of Sputnik vaccines. They did have some issues with quality control of the vaccine. Okay, not the vaccine itself, but how it was produced. So I don't know what India's stance is going to be going forward. And I'm sure they're checking it out very, very well and making sure that the quality is really good before giving it to the patients out there. But just a word of caution over there in terms of what's going on there with Sputnik. And then you said the other question was, what about people who've already had COVID? So when you have COVID, your body, builds this immunity, produces antibodies, memory cells, all kinds of stuff. So currently, if you have had COVID, the recommendation is to wait for at least 3 months. Okay, at least 3 months. And even after that, right now, we have very good data saying that the antibodies are lasting anywhere from 8 to 12 months. So remember, when you have a shortage of vaccines, if you've already had COVID, then you are lower risk of developing coronavirus again. And even if you develop it again, the chances of you getting sick and dying from it are, absolutely not there. So don't run out and get the vaccine. If you have already gotten COVID, let the other people, let the dada and nani and mommy who, the 60 years and older and who've not got their vaccines, let them go and get the vaccines, all right? And then you wait and you be careful, still wear your mask, do all of that stuff, but don't run out and get your vaccine. And if you do have an opportunity to get a vaccine when India has plenty of them, make sure you're 3 months out of your illness before you get one. Angela.
Okay. So that is an important question. Can you see that? For how many days does it take to show that a person suffers from coronavirus, especially for the primary and secondary contacts with the COVID positive?
All right. So the period is from 2 to 14 days, 2 to 14 days from exposure. And that's why what we do is if you know or you think that you have been exposed. Now, remember, exposed doesn't mean that somebody just walked by. It's not like that. It's not like when we step out of the house that there's like this miasma of corona waiting to assault us. So you actually need to have a fairly significant amount of contact and close contact. Remember, coronavirus primarily spreads through droplets. Droplets means, your spit or, when you talk and when you sneeze and laugh and cough, and it gets distributed. And those things don't go very far away. They usually go under 1 meter, which is why we say stay far away, 1 meter to 2 meters away. If you have been close contact, that means less than, we say 6 feet here. I think the WHO may say 1 meter. So 1 to 2 meters. If you've been closer than that to somebody for longer than 15 minutes. So it's not just saying, hey, how are you? And going off and saying, oh my gosh, I've got coronavirus. Okay. We're talking about, I'm having a chitty chat with my good friend, across the table, and we've been at it for 15 minutes. That is a close contact exposure, right? And if that's the case, and if you later on found out, oh my God, Sue had coronavirus, she didn't know, and now she's tested positive and she's coughing at home, and then you're like, oh, maybe I was exposed. And in that case, you can go up to 14 days before symptoms develop, and that is why you need to quarantine for up to 14 days. And I think, Angela, while I'm there, I got another question from one of your viewers, and that was about airborne. Is COVID airborne? And I'm going to go ahead and use this time to address that. There it is right now. Like magic. But yes, first of all, yes, it is possible, but that is not the main transmission mode. Because if it was airborne, what's the meaning of airborne? Airborne means that the virus is not in little particles. So just as we breathe, the virus is coming out, and just on its own without being enclosed in a particle. And yes, we do have some cases of airborne transmission. And especially in high-risk procedures, most of the time it's in the hospital when somebody is putting a tube into somebody's mouth to breathe, or for procedures, or if somebody is like coughing a lot, or if they are singing a lot, then aerosols are produced. And aerosols are a big problem when you have large groups. So if it's just 2 or 3 people in a large building, aerosols are not a big problem because the aerosols are distributed and they're diluted in the atmosphere. But if you have 100 people sitting in a small space, which is very common in India, where we have a lot of people and we love to get together, then aerosols become a bigger problem. But the primary mode of transmission is droplet. Because if it was primarily aerosol, then all of us now would be fully infected. For example, like measles. Measles is primarily airborne. So if nobody was vaccinated against measles and there's one child in the room with measles, when we walk into the room, we're all going to get infected. Okay, but right now with coronavirus, we did the antibody study in our city here. That was one of the projects we did. And we found that there were many households where the husband will be positive and the wife will be negative, or vice versa. So people can be living together and the coronavirus, one person may get it and one person may not get it, okay? So if it was so infectious and fully all the time spreading via airborne means, then we won't have cases like that. The way it is spreading right now is droplet. That means masks will protect, Don't get close to people. And we can get airborne problems when large crowds. That's why I keep telling people, please don't get into crowds. Don't get crowd together in a small space. That to me, I think is the biggest problem in India because of large number of people, and also our culture and our social. I mean, everything is about getting together with people, being with family, being with friends. It's very hard to tell people don't do that. So.
Yeah. So after hearing about whether it's airborne or not, the next question is, which mask is better? What is the affordable mask which works?
Yeah, the best mask for just the ordinary non-healthcare workers. We're not talking about doctors and nurses and stuff, just regular people. So when I'm not seeing patients, I wear a cloth mask made of cotton that is double layer, that is affordable, that is safe, it is effective. You can wash it daily. It does not create an environmental problem. Remember, imagine what would happen is if 137 crore people started using a disposable mask every single day for the next year. I mean, we're going to have lots of other problems. And we don't need that level of protection. These double cloth masks provide an excellent, excellent protection. Now, I do want to talk about a couple of high-risk situations. Let's say you're a high-risk patient. You are older, let's say you're 70 years old, you have diabetes, you have heart disease, and you're a smoker, and you have lung disease, whatever, high risk patient, and you are going somewhere that you have to go. Let's say you're going to the hospital or to the doctor's office. Then we do recommend you wear double mask. You wear a surgical mask. That's the one that kind of looks a little bit like paper, is blue on one side and white on one side. So you put the white one against your face, the white side against your face, and that's the surgical mask. And then you put the regular mask over it. But you don't need to do that all the time. That's for, when you really are in a situation. Obviously, doctors are going to be in a completely different situation. And even doctors, outpatient doctors will be very different from inpatient doctors, compared to the ones that are doing high-risk procedures. And they will have different mask requirements.
Mm-hmm. Yeah, so unfortunately, there have been some questions that came in still about lactating mothers, etc., but you had already answered those. So there's an interesting comment that Corona
I
is
saw
just
one on the screen. Fascinating.
and we're safe in the villages. Although, let me tell you, with this recent surge, there's been a lot of cases in the villages as well. It's just that
absolutely. And that's a very interesting question, because the coronavirus doesn't know if you're in a village or if you're in a city. I mean, it really doesn't. So the interesting thing about the villages is the population is lower, obviously, compared to the cities. But the thing is, if the behaviors are the same, right? If the behaviors are the same, if the village people, let's say there are 1,000 people in the village as opposed to 1 crore people in the city, right? If there is 1,000 people in the village and 100 people get together in a party, it doesn't matter whether there are 100 people getting together at a party in a village or 100 people getting together at a party in a city. It really does not matter. So it's a question of what is your behavior. So the behavior has to be one that reduces transmission. So regardless of whether you're in a village or in the city, don't get together in large groups, and don't go out and be next to people without your mask. And get your vaccine, regardless of whether, because sometime in the village, you are going to go to the city at some point. So I really do hope that even regardless of where people are living, that high risk people, obviously, if you're a young person and you don't go anywhere and you're mainly hanging out at home and you have no medical problems and there's a shortage of vaccines, that's a different situation. But if you have an elderly person or a person with multiple risk factors, please go ahead, and you've got to prevent COVID regardless of whether you're in the city or not. Can we remove the vaccine from our body after being vaccinated? No, you cannot remove it, because it's gone into your blood and into your cells. And so you can't, there's no antidote where you can remove it from your vaccine.
Yeah.
I'm sorry, I just read that comment. I don't know.
That's good.
Sorry.
So there was another question about, what if I've taken the first dose, but I contract COVID, and then how long then should I wait for the second dose?
Yeah, these are all things that you really should talk. There are no studies right now, no studies, because we haven't really had the time to do this kind of thing, because the vaccines have just been out recently. And so again, the issue is, if you've got a vaccine and you have got coronavirus, if it was my patient, I would say, you've got coronavirus so you need to wait for 3 months. That would be my recommendation, because you're no different whether you got the coronavirus before or after vaccination. So if you're positive for coronavirus by PCR, then that is considered a true positive, and then you would be treated like somebody who has, regardless of whether you had vaccination or not.
Okay. And there was a question by WhatsApp. Why so many deaths in the second wave?
Yeah, there's just so many different reasons, and we don't know. There's a thing going around that it is because of a new variant, and that's only in India, and it's hard to know, because right now what we have is only small samplings showing about the new variant in India. But I really think my personal opinion about what's going on in India, knowing what happened in my own family, I think when the numbers became really low, people thought that it was gone. My family thought it was gone. They thought they were done with it. That it has left this world. But the thing is, it may have left some small communities, but did not leave India. So they started. What happened in my family? They started going to parties. They had birthday parties. They had weddings. My dad started going to church. Nobody in church was wearing masks. This was despite me telling them, and my Hindu relatives were going to the temple. My Christian relatives were going to the churches. They were all hanging out at their parties. They even went to tours. They went to Tirupati temple. Everything happened, right? So all you need is one person and these super spreader events happen. So super spreaders are, these, unfortunate individuals that, really have this ability to spread to a large group of people. We now know that 80% of the infections are caused by 20% of the people. Okay, so it's not like everybody doesn't have the same infectivity. So I may be giving it to 20, 30 different people, and my husband may not give it to anybody. So if you have a situation, let's say you're at a wedding party with 1,000 people and you have a super spreader there, blam, you're going to have a whole bunch of people getting it. And I think that's really what happened, because people dropped their guard. But I want to make an important distinction here. There is, being cautious is really important, but being afraid and terrified to live, that is not what I'm talking about. We had a sad case of a neighbor who here in the US before the vaccine. She had not come out of her house for a whole year, did not step out of her house. She got everything delivered to her home. She didn't even take her dog out for a vaccine. For a vaccine. I've been talking so much about. Didn't even take a dog out for a walk. This is not what I'm recommending. This is not what is needed. You can still do a lot of things very safely. Know that when you're outside, again, this is the difference between India and the United States, because when you're outside in the United States, there's hardly any people. But when you're outside in India, there's a lot of people, especially if you are in a big city. But if you're in a small village and you are outdoors, feel comfortable going outdoors. If there's nobody outside around you for, long distances, 10 feet away, you can be outside, is perfectly fine. And outside reduces the risk by 20 times. You're 20 times less likely to get coronavirus if you're outside versus inside, because of all the ways in which it is transmitted. So please don't stay home, be terrified, have your, my poor dad, I don't know if dad is watching, but my poor dad, he has his mask on like 24 hours a day, and it's like constantly following. I'm like, Dad, why are you doing this? But there's just a sort of fear, and I want people to know masks are good. They're not an armor. Masks work very well when you're going to be close to people, okay? And if you're sitting by yourself at home, you don't need a mask. If you're walking your dog by yourself in an empty street, you don't need a mask, okay? So be careful and be smart, but don't isolate yourself for months at a time because you're so terrified. I want to really bring that home to the people that are watching today.
So some more questions, though, about vaccines. Do we still have to wear a mask? Another one says, these current vaccines trigger the immune response. What are potential long-term effects for people who already have a strong immunity? Then somebody says, does it provide lifelong immunity, or what is the regular interval at which we will then have to take the vaccine?
Yeah, these are all speculations at this point, really, because we don't know. We can make educated guesses. We right now feel that the vaccines will we're hoping that they'll be good for at least a year. That's the plan, because natural immunity, we know now it's been a year, and we are finding out a lot of people that have been infected are maintaining their antibodies for about a year. So we're hoping that the vaccines, which are actually shown to produce an even more robust immune response. So we're hoping that we didn't have a lot of variants, and if the variants are not causing a lot of trouble, these vaccines may be good for a while. So I'm really hoping that these are going to be good for a year or two at least. And then if we need to get, here in the US, we're very used to taking our flu shots every year. It's just a part of it. And there's talks now of combining the flu vaccine with the coronavirus vaccine, and we just get one every year. So we don't know if that's what's going to happen. And we'll know a lot more about it later. And I think there was another question, and I'm sorry, I forgot. I forgot what you said.
Which one? The one about whether it will affect our natural
your immunity. Yes, that is a very interesting question because especially the mRNA vaccines, because they really create a very strong, robust immune response. I mean, like 95% efficacy. I mean, that is very, very unusual, so very strong stuff. And it's a valid point as to whether it is going to cause autoimmunity or not. And we've had the vaccines have been out now for about 4 months now, the mRNA vaccines here in the United States. And basically we're having just few cases, very few cases of autoimmune called ITP, or immune thrombocytopenia, immune thrombocytopenia, and where you can either where the platelets, which are little particles in your blood, they reduce, and when that happens, you can either bleed or they become abnormal and you can clot. So either one of those things can happen, but that is really, really rare. Now, if you are somebody who has had multiple episodes of autoimmune reactions to other things, so we're not talking about somebody who has an autoimmune disease right now. So let's say you have an autoimmune disease right now, like rheumatoid arthritis, or if you have lupus or something like that. Right now, everybody is uniformly in agreement that those people are at higher risk of dying from coronavirus than getting any problems. So what the doctors are doing is watching them really carefully. So make sure that if you are a person with an autoimmune disease already, that you're under the care of a rheumatologist. The rheumatologist knows that you've taken the vaccine, and keep in touch with them and make sure that they know how you're doing, okay? So don't just, if you're a lupus patient and you're taking all these medicines, don't just jab yourself with a vaccine and just stay home and not worry about it. Keep your doctor in the loop, okay? But the answer to that, now, if you have had episodes of, severe autoimmune reactions to other vaccines in the past, talk to your doctor, because they are the ones who are going to be able to give you the best advice for your individual case. But as a population, it is very, very, very low.
All right. So, we are running out of time. We'll have to wrap up in another 5 minutes.
Okay.
There was a very specific question from somebody from Joy.
Okay.
I'll forward that to you, and perhaps you can respond, and I'll forward it back to her because I have her number. It's about she has had corona since 30th April and seems to be having some post-corona infection. So I think that is too specific. But perhaps we need to... we can wind up the session by a very interesting question, which says, what is your view on conspiracy theory that coronavirus is fake and exaggerated?
I hope from all the stuff that I have talked to you about now, you are 100% convinced that this is not fake. I don't know what else to show. We are seeing it on a daily basis as doctors, and now you don't even have to be a doctor to see it. You just have to see it in your community. People are dying from it. So it is not fake. It is not a conspiracy. And why would we do this? There's too many important things in life to be going around making up stories about such things. It is not a conspiracy, and neither is it a death sentence. So we have to keep that in balance. It's not a death sentence. It is not a conspiracy. It is a serious illness that most people will recover from. Okay, we have very good ways to take care of people now. We have this amazing set of vaccines that we have now. So hope is there. Look at us. Look at us, the United States. We were in a horrible condition in December. In November, December. People were tired of the pandemic. It was Thanksgiving, the big holiday in the United States. Christmas was coming up. And, people just couldn't handle it anymore. They went together. They wanted to hug their mommy. They wanted to kiss grandma. That's what happens. And all of us were in a terrible situation and it looked horrible. And then the vaccines came. I mean, that's and they came, and now the death rate has gone down by 80%. And in Israel now, for the first time, they've had zero deaths after vaccination. They have the most aggressive vaccination program in the world. And after they got 60% vaccination, their rates just plummeted. And in the United States now, we have around 50%. We have enough vaccines for everybody, but we do have quite a bit of vaccine hesitancy in our country, and we're working on that. But even with 50% vaccination, we have plummeted. So there's so much hope. I don't want anybody to feel hopeless, feel desperate. That you are in control here. You can definitely protect yourself, protect your family, ask people the right questions. Don't be scared by looking at WhatsApp and Facebook. I have just turned off all of those things because, people are just spreading so much misinformation, not just misinformation. Sometimes it is real information, but it just creates a lot of fear without any purpose. What is the purpose of creating fear? There is creating awareness on one side, and then there's creating fear on the other side. So let us not create fear. I don't want to know there's like 50 people who just died over here and there, and they're not getting oxygen and there. Yes, we know there is an oxygen shortage. Yes, we know that there are bed shortages. We don't need to know every 2 minutes that that from this person and that person and that person. So turn off all those things for your sanity, because we've been having people with panic attacks, people with chest pain when they're having so much fear. And if you are the type of person that is spreading fear through social media, please think twice before you click the post. And if you are the type of person that cannot scroll through or cannot you have to pay attention and you're terrified when you see it, just block people. I block people all the time. I turn things off. I take the WhatsApp and things off of me. I have very specific people on there. I do not watch daily news because there's no reason for me. I'm not going to change. I'm part of the COVID Mitigation Committee here in our city here, and because we make the decisions. The team and the city. When to open the restaurant, when to open the park, when to close certain things. Those kind of things. Even we don't need that kind of information on every 5 minutes. Okay, so what I do is I wait for the information from the authorities, whether it is the American Medical Association or it is, the UpToDate or something like that, that is going to give me good information about the vaccine. I'm sorry, I know I talk fast and I talk a lot, but I want to make sure I share one thing with you when we're talking about resources. When physicians are so tired, overwrought, exhausted, taking care of patients, they don't have time to go and read all the latest clinical stuff, go through and read all the different studies. We just don't have the time. So what we have here in the US is a wonderful resource called UpToDate, all one word, uptodate.com. I do not own shares there. I don't have any interest in UpToDate, but I have been using it for more than 20 years now, and I know a lot of our colleagues use that. And normally it's like $600 or something a year, which is very expensive even here. So that's like 50,000 rupees. But what UpToDate has done is it has now made all the articles for COVID free for doctors in India. So I'm just so excited and so thankful. And if you all know doctors, or if there are medical people here, or if you have other doctors in the family or friends, please let them know about uptodate.com. And if Angela, if you guys can, promote that as well, so that doctors that are working so tirelessly in the clinics and in the hospital, they can keep up to date. What are the most recent recommendations? Because unfortunately, when information doesn't get through. So, for example, we were, using things like plasma, using things, certain antibiotics in the beginning and stuff like that. that have not worked. And if you are a doctor that is in a remote place and you have not been able to get that information, you may still be recommending those treatments to your patients. And so we want to make sure that our healthcare workers are supported and they have a resource. So now they have a resource where if they have a COVID positive patient, either in their hospital or in their clinic, they know what the most recent guidelines are. So please go ahead, and I hope you can popularize that resource. Thank you, Angela.
All right. Thank you so much for your time. And hopefully, if there is a demand, popular demand, we'll ask you to come back.
Absolutely. Absolutely.
Maybe we can try a multilingual thing in Khasi and English.
That would be
more
wonderful.
people have access to information like this.
Yes, definitely. Definitely.
Thank you so much. And thank you again to T7. And from Tur, we would like to thank everybody who sent in questions and who are listening. And as you said, I'm sure we needn't be so fearful. We just need to be aware and take care, wear our mask, get vaccinated, and I'm sure we can get through this together.
Absolutely. Absolutely. Thank you so much, Angela. And thank you to Tara and it's just been a delight to get together with people from Shillong. I do. It's Kublai Shibun. I don't know if I'm saying it right, but I remember Kublai. Kublai Shibun to all the wonderful Khasis that are out there that are listening to me today. I want to let you know that you are not alone. The entire world is with India. Everybody. There's people here that don't know where India is. They won't be able to point it out on the map, but they are praying for you. They want to help you. We're all in this together. I know that in a few months you will be in a different spot. You just need to do your part. Things are in your control. Things will get better, definitely. Thank you so much again. A pleasure and a privilege. Bye-bye.
Thank you so much. Yeah.
Take care.
Thanks.
Bye.
Bye.